Hello everyone, and welcome to this audio podcast. This audio podcast was part of as part of a Proxi beat. This audio podcast is part of the Catharsis Scrutiny. This audio podcast is part of the Libostics Interfold, and this audio podcast is part of a Storm Libostics production. So, as part of this audio podcast, there will be a sort of a Q&A aspect, and where part of this or previous to this, there was an audio podcast, that looked at the that had a similar underpinning. However, as part of this audio podcast, um, um, the there will be a sort of a sort of uh, a revisit on this. So in around the sort of Q&A aspects. So in around question one, what is chronic kidney disease? So CKD or CKD complication stems from a complex primary comorbidities, at least in the adult population, ultimately becoming multi-systemic. Children and young people, CKD etiology can originate for several reasons, from congenital, hereditary, to endocrine and physiological complications. Owing to the nature of disease, CKD patients or recipients also encounter various national health services, such as laboratory investigations. CKD CKD patients are also can also be prescribed varying medications throughout the disease pathway, varying around the disease pathway, irrespective of pre or post transplant or post transplanted. CKD patients are being at the same time. CKD patients sort of at the same time want more face-to-face understanding of test and investigations, or at least have health professionals be part of discussions 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 and consultations, for example, where they can get more more robustness in more robustness in around healthcare, by improving patients' understanding and education relating to those important laboratory tests and investigations that surround CKD. This would also reduce inequity of care and improve the health of the CKD population. So question two, what are the main issues surrounding educational support for CKD patients right now? So support for patients or recipients with long-standing conditions like CKD can be ascertained through a variety of mechanisms between health sectors and from professionals, and this can be multifaceted. The understanding provided by an array of health professionals relating to laboratory test and investigation also unfortunately can add to complexity. Um, and at the same time, bear in mind that varying health professionals tend to get involved in providing a basis in around laboratory tests and investigations, um, uh, and where, for example, those who are not or do not have, for example, laboratory specialists sort of understanding, can cause cause sort of implications to recipients or patients experiences. So patients see various members of the multi can see varying or several members of the multidisciplinary team or MDT at varying times, and this can lead to recipients or patients having misinterpreted sort of results in around their laboratory tests and investigations. So question 3: what mechanisms what mechanisms of educational support exist? So where recipients or patients would normally see more than one health professional, identifying and having access to peers to help inform shared decision making is advantageous, but further to schedule see online consultations or consultations with those who are trained to provide remote education and services is becoming or has become more important owing to remote working and online support and online and where sort of online support groups, for example, the kidney disease and renal support group or KDARS for kids, which has been working through social media platforms to improve CKD awareness, chronic kidney disease awareness, since 2014, and with the renal patient support group, the RPSG, since 2009, since 2000, which was where the RPSG had been founded since 2009. And so empowered recipients or patients are more probable to make informed decisions surrounding healthcare choices, and education is also has and is is and has become an important mechanism for most most patients in around this long-standing condition. Now, question four is education support around the science of CKD important? So to answer this question, I would like to provide context wherein, whilst it is to be appreciated that healthcare scientists do not train to have a sort of a clinical involvement in around patient care, they do have an unused knowledge base and a basis in around the National Health Service. The National Health Service has been to involve diagnostics with the rest of clinical medicine or medicine, and to make crucial layman bases available in a timely way in line with saving lives. So in around question 5 then, or part of question or part of a question or a point in relating to number 5 here, implications to practice and research. So educating at the same time educating healthcare professionals about the importance of the recipients or patients' role, and how to interact with patients is another has been a focus, and evidence indicates that healthcare professionals using professional or expert language or technical jargon without patients or recipients having knowledge in the first instance will continue to act as a hindrance and barrier to communicate. Targeting the attitudes and behavior of service providers through potential solutions is important, and so that the relationship or the interplay between service users and service providers is balanced and better. So in around the summary here, collaborative patient-centered practice is designed to prompt the active participation of each discipline in around patient care or healthcare. Collaborative working embraces or enhances mechanisms for continuous communication, optimizes healthcare professional and service provider participation in decision making, as uh, within and across disciplines, and fosters respect for interdisciplinary or disciplinary interdisciplinary or disciplinary basis from all. That draws this audio podcast to a close. This has been an audio podcast as part of the Proxy Beat, an audio podcast as part of the Catharsis Scrutiny, an audio podcast as part of the Lobostic Interval, an audio podcast as part of a Storm Robotics production. Thank you.